Hey guys, my name is Ramsey, and today I want to talk about and demonstrate how to don and doff for contact precautions. But before I get into that, I want to talk about something that's really important, and that's standard precautions. So standard precautions are practices used to prevent infection, and these practices apply to the care of all patients in all healthcare settings. And this operates under the assumption that open skin, mucous membranes, and all bodily fluids except sweat are potential sources of infection. And so standard precautions consist of hand hygiene, washing your hands or using hand sanitizer, which is the preferred method, respiratory hygiene, for example, sneezing into your upper sleeve or elbow if you don't have a tissue, and the use of personal protective equipment. So contact precautions consist of the standard precautions that I just listed, and the personal protective equipment that you would use would be gloves and a gown. And contact precautions are used with patients who are known or suspected to be infected with diseases such as MRSA, VRE, or if they have open wounds exposing some bodily fluids. And so now I'm going to show you guys how to don and doff. Okay guys, so now I'm going to don and doff for contact precautions. So the first thing that I want to do every time I'm donning personal protective equipment or going to see a patient is to clean my hands. So obviously the easiest method and the preferred method for most healthcare settings is to use hand sanitizer, specifically Japanese cherry blossom hand sanitizer. So you want to apply this for about 15 seconds and make sure that everything's dry. You get the entire surface of your hand. The reason that I would not use this cherry blossom hand sanitizer is if my hands were visibly dirty, if I had any organic material on them, if I had touched any material or clothing that had been previously infected or soiled, and if I had used this hand sanitizer 10 times previously. And then I would wash my hands with soap and water for 15 to 60 seconds if I had definitely touched some infected material. So now that my hands are clean, first thing I want to do is don this gown here. So I'll shake this out. So I'm going to tie this upper part first. Now the lower part here. And you want to tie it appropriately so that you have freedom to move. You don't want to restrict yourself, but you also don't want to expose any of your skin. So the next thing I'll do is don these gloves, and you want to get the gloves over the cuff of the gown here so that no skin is exposed. And so when you've got all this on, you want to test yourself to see that no skin can be exposed. So you reach out, make sure that the gloves stay over the cuffs here, and you bend forward, make sure that the gown isn't coming off around my neck or around my waist. So now to doff, the first thing I'll do is take these gloves off. So I want to make sure to not be touching the outside of these. They're soiled now. Gather this in this hand, and then use this hand, get up underneath the glove, pull that off slowly. And so now the soiled part is entirely on the inside. And I can throw those away. And now when I take this gown off, I want to be sure to not touch the outer soiled portion of this. So I'll untie this first in the back. And I'll untie the top. And I want to be very sure to not touch the outside. So I'm only touching the inside here. shake this off like this. And then you want to roll this up nice and tight. Get the soiled part on the inside, and then dispose of it. And that's Doff for contact precautions.